Have you ever looked in the mirror, stuck out your tongue, and thought, "Looks normal to me"? Well, your tongue might be trying to warn you about things happening inside your body, long before symptoms show up. From nutrient deficiencies to infections and even serious health risks, your tongue can reveal a lot. Today, we're decoding what your tongue says about your health, backed by real medical science. Your tongue is one of the strongest muscles in the body, but it's also a health dashboard. Doctors, especially in dentistry and internal medicine, often examine the tongue because it reveals early clues about systemic health. Let's break down the most common tongue signs and what they actually mean. A thin white coating is normal, but a thick, patchy, or cottage cheese-like white layer may signal oral thrush. Oral thrush is caused by Candida albicans, especially common if you've taken antibiotics, have diabetes, or a weakened immune system. A white coating can also indicate dehydration or dry mouth, as not drinking enough water reduces saliva and allows bacteria to accumulate. Poor oral hygiene is another cause, where bacteria, food debris, and dead cells layer up on the tongue. When to worry? If the white coating does not scrape off or comes with burning, get checked by a medical professional. A tongue that looks unusually bright red or glossy often signals vitamin deficiencies, especially B12, folate, or iron. These nutrients help produce healthy tongue papillae. When lacking, the surface becomes smooth and shiny. Inflammation, known as glossitis, can also cause a red tongue due to allergic reactions, infections, or irritants like very spicy foods. Kawasaki disease or scarlet fever are rare in adults, but important signs in children. If your tongue is bright red and painful, it's worth checking for nutrient deficiencies. A yellow tongue is usually not serious, but still meaningful, often indicating bacteria overgrowth. This is common in people who breathe through their mouth or smoke. Gastroesophageal reflux, or GERD, can also cause discoloration as stomach acids alter bacterial balance. Jaundice, though rare, is serious. If your skin and eyes also appear yellow, it could signal liver issues, requiring immediate medical attention. Black hairy tongue sounds scary, but it's usually harmless, often caused by smoking, excess coffee or tea, antibiotics, or poor oral hygiene. The tongue papillae grow longer than usual and trap bacteria that turn them dark. Good news, it goes away with better brushing, tongue cleaning, and cutting down on smoking. Cracks or fissured tongue are deep grooves along the surface, and while mostly harmless, some people are simply born with them. They can be linked to dehydration, nutrient deficiencies, Down syndrome, psoriasis, or Sjogren's syndrome. Keeping the tongue clean prevents food from lodging in the cracks and causing irritation. Geographic tongue presents as irregular red patches with white borders that shift location, like a map. Despite its unusual appearance, it's benign and not contagious, with triggers including stress, hormone changes, spicy foods, and vitamin deficiencies. Some people experience burning sensations, but it usually resolves without treatment. Sore or bumpy tongue often indicates canker sores, small painful ulcers caused by stress, injury, or immune reactions. Trauma from accidentally biting your tongue or brushing too hard can also cause bumps. Food sensitivities, especially to acidic foods like pineapple or tomatoes, can also lead to soreness. If a bump doesn't heal within 2 weeks, it should be checked by a doctor or dentist. A lump that doesn't go away is the most important sign to notice, as it could signal oral cancer, chronic irritation, or viral infections like HPV. Red flags include persistent pain, a lump lasting longer than 2 weeks, difficulty swallowing, or numbness. If you see any of these signs, early detection is key for effective treatment. Your tongue is more than a tasting tool. It's a window into your overall health. So next time you're brushing your teeth, take a quick look. Your body might be telling you something important. If you enjoyed this science-backed breakdown, don't forget to like, subscribe, and share, and stay tuned for more health insights.